Breast cancer is the result of epithelial cells in the breast growing uncontrollably to form a lump or tumor. These malignant cells can invade surrounding tissues and spread via the lymphatic vessels to areas outside the breast, leading to metastatic breast cancer of the lung, bone, or brain. Interestingly, breast cancer doesn't cause pain until it has spread. Hey everyone, this is Holly Knutson. I'm a functional health practitioner from Utah, and today I'd like to continue my cancer series and talk about 10 facts regarding breast cancer that every woman should know. The words breast cancer instill fear and terror in anyone receiving this dreaded diagnosis, but it's important to understand the different types, stages, and grades of breast cancer because some forms are less aggressive than others. In this video, I want to break down the various types of breast cancer in terms of disease risk, outcome, and treatment options. Here are 10 facts about breast cancer every woman needs to know, considering the disease affects 10 to 12% of women, with 1 in 8 in the United States developing the disease. Excluding skin cancer, breast cancer is the most common type of cancer affecting women in the U.S. and is the second leading cause of death following lung cancer. The American Cancer Society estimates that a staggering 268,000 women will be diagnosed with invasive breast cancer in 2019, with 62,000 cases being diagnosed with the non-invasive type. And this will lead to over 40,000 deaths. Men can get breast cancer as well, but the instances are rare, with only 1 in 1,000 men developing the disease. What is breast cancer? Breast cancer is the result of epithelial cells in the breast growing uncontrollably to form a lump or tumor. These malignant cells can invade surrounding tissues and spread via the lymphatic vessels to areas outside of the breast, and this leads to metastatic breast cancer of the lung, bone, or brain. Interestingly, breast cancer doesn't cause pain until it has spread. Most breast cancers are ductal cancers, and this means they occur in the milk-carrying ducts of the breasts, but some cancers originate in the glands that produce breast milk, and these types of cancers are called lobular cancers. Cancer cells within the breast can form lumps, which can often be found in the early stages through mammography or self-examinations before symptoms occur. Not all types of breast cancer cause lump formation. It's important to keep in mind that most lumps found in the breast aren't malignant, but rather abnormal benign growths contained within the breast, and they're not dangerous. Benign lumps may possibly increase future breast cancer risk. Now I want to go over the types of breast cancer. First off, non-invasive breast cancer is characterized by fast-growing cells that have not yet spread beyond the breast, and therefore this type of breast cancer is not life-threatening. DCIS, or ductal carcinoma in situ, is a non-invasive type of breast cancer that may potentially be precancerous but may not cause any future issues. Many practitioners, including Dr. Christiane Northrup, a board-certified OB/GYN physician, now believe that DCIS is something you die with rather than something you die of. A 1995 Lancet study noted a 328% increase in DCIS over a period of 12 years, with a 200% increase due to mammography use. Invasive breast cancer. In this type of cancer, cells grow abnormally fast and spread to other areas of the body. Invasive breast cancer develops over years, with mutations slowly changing normal cells into malignant ones. This type of breast cancer can be life-threatening. IDC, or infiltrating ductal carcinoma, and ILC, infiltrating lobular carcinoma, are the two most common invasive cancer cell types. They are treated conventionally with surgery, radiation, hormonal therapy, and in some cases chemotherapy. And there are other types of invasive cancer of the breast as well, but they are less common. Now let's go over the stages of cancer. Knowing the stage of the cancer is significant for assessing how aggressive The cancer is based on tumor size, lymph node involvement, and the degree of metastases. Cancer stage differs from cancer grade, which references the abnormality of cancer cells when viewed under a microscope. Stage 0, the cancer is contained to one area, has not spread, and is referred to as in situ. Stage 1, the earliest stage of breast cancer, characterized by a tumor that is no bigger than 2 centimeters. And in this stage, cancer hasn't spread to the lymph system or bloodstream. Stage 2, in this stage, the cancer has begun to spread into nearby tissues, including the bloodstream and lymph vessels, with tumor size exceeding 2 centimeters. Stage 3, this is a more advanced form of cancer, and the tumor may be small or large, and cancer cells start to surround the tissues and lymph nodes, but the organs are not affected yet. Stage 4, cancers in this stage are advanced, malignant, invasive, and metastatic, affecting both tissues and organs. What is the importance of knowing your tumor receptors? Cells contain proteins or receptors on their surface. These receptors are responsible for turning cancer growth off or on. They're kind of like light switches. And there are 3 types of breast cancer receptors: estrogen receptors, progesterone receptors, and HER2 receptors. And receptors are not related to the stage and grade of cancer. Knowing what type of receptors are on the surface of cancer cells will help determine the nature of the cancer and dictate treatment options. If the result of a breast biopsy is invasive, tests are run on that same tissue to determine which receptors are present. And this is where it gets complicated because the various receptors can be either positive or negative. Here are some of the breast cancer receptor types. Estrogen receptor positive, or ER+. This type of cancer has receptors for estrogen, which promote cancer growth. It's the most common type of breast cancer, with 2 out of every 3 cancers testing positive for hormone receptors. Estrogen receptor negative, or ER negative. Cancer cells don't respond to estrogen and progesterone signaling and are typically treated with surgery. Estrogen receptor negative cancers may, however, still have receptors for HER2. Progesterone receptor positive, or PR+. Receptors for progesterone are found on cancer cells. HER2+. HER2 is an oncogene that promotes the development of cancer and makes it more aggressive by producing a gene that sits on the surface of breast cancer cells. In HER2-positive cancers, receptor genes are overexpressed, and this leads to too many copies of the gene, which then causes the cancer cells to be more aggressive. And finally, triple negative, or ER negative, PR negative, and HER2 negative. This is a highly aggressive form of cancer that is more likely to be metastatic, and triple negative cancers test negative for estrogen, progesterone, and the HER2 protein. This type of cancer does not respond to hormonal therapy. It's possible that hormone receptor positive cancers may lose some of their receptors over time, and the converse is also true that hormone receptor negative cancers can gain receptors over time. Hormonal therapy is used to interrupt the effect of hormones on cancer cell functioning and growth. Well, what are the signs to look for? It's critical to be aware of potential signs of breast cancer, including changes in breast size and shape, nipple discharge or inversion, skin dimpling or puckering, persistent pain in one area, discoloration, scaly patches of skin, redness or swelling, areas of warmth or darkening of the breast. But don't be unduly alarmed if you notice any of these signs, because most don't turn out to be breast cancer. But be smart and get promptly checked just to cover your bases. Diagnosis is usually confirmed through a biopsy to determine if a mass is malignant or benign. If it is malignant, further testing is required to determine if metastases has occurred and which treatment options will be the most effective. Outcomes depend on the age, you are at the time of diagnosis, the type of breast cancer you have, receptor type, and the degree of metastases. Here are some of the risk factors for developing breast cancer. Obviously, if you're female, if you're overweight, if you're sedentary, if you have never breastfed a baby, if you drink alcohol frequently or if you smoke, if you've been around ionizing radiation, if you began menstruating before the age of 12, if you bore children at an older age, or you never experienced a pregnancy, if you have a family history of breast cancer, or, and this is interesting, if you have a caretaking personality and always put yourself last. Under 10% of breast cancers have a genetic link, including the BRCA1 and BRCA2 genes. While you can't control your genetics or your family history of cancer, it is possible to reduce your risk by how you live. Okay, let's talk about treatment options. Breast cancer is complex. It's a very complex disease with various treatment options and approaches available. Treatment will depend on the type of cancer, the stage and grade, along with receptor type. It's critical to remember that you don't need to make a rash decision regarding your treatment or let anyone else persuade you in doing any treatment that you're not comfortable with. So take your time and weigh all your options before deciding. Conventional treatments include surgery, radiation, chemotherapy, neoadjuvant chemotherapy, and that's chemo given before surgery, hormonal therapy, and targeted immunotherapy. Some patients choose to be treated solely using alternative cancer therapies, or using alternative cancer therapies in conjunction with conventional therapies. Biopsies, ultrasounds, mammograms, genetic testing, genomic assays, MRIs, CT scans, PET scans, and chest and bone scans are used diagnostically. 10 facts about breast cancer your doctor might not tell you. Number 1, chemotherapy does not kill cancer stem cells. It only kills tumor cells. Number 2, only 5% of cancers are genetic. Number 3, unhealthy lifestyle habits can turn on cancer genes. How you move, how much sleep you get, how you think, your emotional wounds, and even the health of your mouth are all vitally important in determining cancer risk. Negative gene expression can be altered by engaging in healthy lifestyle strategies, as has been seen in the study of epigenetics. For instance, nutrigenomics is the science of how food impacts gene expression. Number 5, sugar feeds cancer. Since cancer cells have more insulin receptors on their cell membranes, eating sugar fuels their growth. Number 6, cancer is a preventable disease if major lifestyle changes are implemented. Number 7, 10 million people will be affected by cancer worldwide. And that's pretty sobering. Number 8, alternative cancer therapies help, and they can be used in conjunction with conventional therapies to help build the immune system. Number 9, chemotherapy and radiation increase stem cells and circulating tumor cells. A long-term cure isn't possible unless these stem cells or tumor-initiating cancer cells are eliminated. Chemo actually increases stem cell resistance and makes them more aggressive later on, and then you require even more chemo and radiation. This is significant because stem cells are responsible for cancer spreading or metastases. Number 10, alternative cancer treatments have a positive effect on stem cells. And this is one reason they're so effective. Alternative cancer treatments have a positive effect on stem cells. For instance, sulforaphane, or broccoli sprouts, have been shown to kill stem cells. And that's pretty amazing. Halen is a non-GMO fermented soy product that originated in China, and it also inhibits stem cell production. There are many more alternative and complementary cancer therapies that have been used successfully to treat cancer. In summary, although up to 10% of women will be diagnosed with breast cancer in their lifetime, 90% will be cured with treatment. It's vitally important to look for possible signs that could indicate cancer and reduce your risk of developing the disease by adhering to a healthy lifestyle such as eating well, exercising, aiming for a healthy body weight, not smoking, limiting alcohol consumption, learning coping strategies for dealing with stress, and even evaluating your relationships, and also decreasing your exposure to environmental and household toxicity. Cancer is frightening, but you can reduce your chances of developing it by being your own advocate. If you have cancer, I wish you well on your healing journey. Have you or someone you love had breast cancer? Please take the time to leave a comment below this video. Thanks for watching.